So today we're really excited. This is our second annual conference of the UKSI Mental Health team. We were really shocked by the number of people that chose to come last year, so we're hopefully bigger and better this year with different sessions going on around athletes, but also how we think about staff and the team around our athletes and different professions. So we're just really excited to be expanding it this year. We've really established that there's a wider audience for this. So we will obviously have Olympic, Paralympic sports, but also we've got Premier League here. We've got other sports that are really showing an interest in what we're doing as an organisation. The concept of this is, mental health in elite sport is everyone's business, and thinking about how we do it all together. And this is just a brilliant setting and a brilliant forum to bring everybody together, and we're really excited.
I think historically mental health has had a stigma, and it's been difficult for people to come forward, talk about when they've got an issue and to raise concerns. I think that landscape is changing. I think we're recognising that mental health and being well is as important as being fit and being healthy.
So talking about mental health in elite sport is, I think, just a crucial part of our job. We look after whole people, whole athletes, and we know that mental health is just a fundamental part of that. And we've seen vast improvements in how that the literacy around that works and is integrated into sport. So being able to come together as a group of interested, integrated practitioners hopefully helps propagate those messages and improve standards.
There's so much that goes into performance, there's so much that goes into the everyday living, and it's a lot more than about what you see on a track and on a court. And so it's really critical that we get to know more about what's going on behind the scenes so that we can support athletes as best as possible to be best versions of themselves on the court and off the court.
I think looking after mental health and talking about it when we're providing sports medicine care to athletes is absolutely vital. In my clinical experience, I've found that can often be a really, really challenging area of looking after athletes, but it's something that is very, very common and comes up very often in an athlete's career around times of illness, injury, deselection, coming off programme, particularly around major competitions as well. So it's absolutely vital that we look after both the mental health of athletes and physical health as well.
There's been some brilliant sessions already. Being able to hear the PhD updates is incredibly interesting. We had an intro to a couple of them last year, and be able to see them being brought to life and how we can start to integrate that into clinical practice, along with the new PhD that's going to be done on ADHD, is a really exciting piece of work.
One of the main takeaways from today's conference is reinforcing the MDT work that the sports psychologists and the clinical psychologists can do in terms of responding to mental health challenges, as well as proactively preparing the environment to alleviate some of the mental health challenges that athletes might experience.
I think for all of us working in sport, mental health is a theme that we talk about regularly, but sometimes, particularly if you're non-specialist, you maybe don't feel fully comfortable and fully aware. So from a CPD perspective, it was important for me to pick up on what people are talking about on the current theme. So remaining current was a particular takeaway.
I really loved today's conference, and there's so many things that I could take away, but one of the things that I think has really shone out for me is having so many different people in the room with different perspectives on mental health and how we support athletes in making sure we wrap around the best possible support to athletes, but also staff around mental health. And it's been really interesting, I think, having everybody from practitioners to leaders to people who work in our system, but also hearing from people who work outside our system and what we can learn from them and what they can learn from us. So yeah, it's been a really enjoyable day. It's been a really interesting day, really thought-provoking.
It's been a really, really great day here at our mental health conference. We've had around 130 people attend, which has been way more than last year, way more than we expected. We've had 6 sessions across the day, and we've heard from lots of different practitioners and people from across the system, and also people from outside the system. And it's been really fabulous to hear everyone's feedback, how much they've enjoyed it. And I mean, you can see behind me how many people have stayed for the networking at the end. It's just brilliant to see so many people here connecting and catching up. And we look forward to seeing you all again, hopefully next year.